Hello, dear colleagues. Right now it gives me a great pleasure to introduce you the new course that is available on OHI-S platform. The pleasure because I personally know the speaker and we became friends from the first minutes of our acquaintance because he's a fantastic person. He is great orthodontist and very good teacher, Dr. Kleber Meireles from Brazil. And this course dedicated to the bands and loops in orthodontic practice for their good finishing result. What I like about Kleber Merlish approach to education is that how easy you can listen to his lecture, to his presentation, because you are not strained. You don't feel that this is, higher, maybe mathematics or some non very understood topic, something that is not clear. No, he always managed to explain complex things in a simple way, and that required a lot of effort and a lot of preparation because for during his 20 more than 20 years of career, Dr. Kleber Merlish himself being a clinician found that there is a lack of knowledge about biomechanics in our profession on orthodontics, and so he was constantly searching for the information, for the knowledge, for some kind of educational courses dedicated to biomechanics, and he understood that there are not so many good education dedicated to the biomechanics in orthodontics. So when he mastered this topic, when he started to utilize it in his clinical work, and when he started to see the difference in the clinical results, he decided that he wants to share this knowledge with every other orthodontist. And it's not just, simple lecture, look what I'm doing, do it the same way. He started to prepare the didactic, the educational material. And his presentations, although they seem very light, very easy to understand, very clear, but that is because there is a lot of effort in creating each slide. There is a lot of there are a lot of animations, a lot of schemes, a lot of videos that he prepared himself. He did it himself. And I asked him once, Kleber, how long does it take from you to prepare one slide in your presentation? And he told me, well, 2 weeks at least, because you'll see how detailed are they, how they are constructed in a way that you will not have any questions after you watch his presentation. And we know that theme, the topic of bands in orthodontics is very controversial because unfortunately, banding in orthodontics is not so nicely given during our residency or at universities. So many orthodontists, they get a certificate of orthodontist without the knowledge how to use the bands, how to apply the bands, or how to work with the bands. I'm not talking even about the loops, that for some orthodontists, loops are something beyond their grasp, unfortunately. So having this kind of, I would say, inferiority complex because we don't know something that is actually in the DNA of the orthodontic treatment, we try to avoid it. So we try to avoid uh, the difficulties of placing the band during the appointment. We're trying to avoid the treatment where there will be the necessity to make the band. So we are using the appliances that are advocated, that are actually marketed as appliances that don't require any bands. For example, aligners and some kind of fixed appliance, whether it will be the self-ligating or ligated brackets, straight wire appliance, doesn't matter. And there are some doctors who will be the representatives of some systems that will tell you if you use this appliance in that way, if you do the panel repo and so on, you will never have a need to make the band. That's not necessarily the case. That's not often the case. And even though the appliances are very good, the techniques are very good, but it makes sense to know something and to be able to do something with your own hands. What is good about Dr. Kleber Merlish's lectures that he is not dependent from any system. He is not marketing or promoting any system. He can work with everything. He likes aligners. He likes to treat patients with aligners, but he still trusts to the fixed appliance, to the braces, much more than to the aligners. And sometimes he's combining both appliances and treatment of the patient in order to save time and to be more effective. So bands they have to be taught in the right way so we can master them. And the way he gives his presentation, his course, you can really repeat these bands easily and correctly. It makes sense actually to have a pliers in one hand and have an HY in another hand, and during the course practice the banding. And he gives you a very comprehensive information about the biomechanics and about the manual instructions how to perform the first order bands, the second order bands, the third order bands, the question of torque, and he gives you a lot of clinical examples, and also very often he will repeat information again and again so that you will be able to completely understand it and memorize it in order to be able to do it very quickly and effectively on every appointment when it is indicated. So he will give this designated special lecture about the loops and how to bend the archway in order to create a certain shape of the loop, how to use these loops. So he gives you a lot of situations where bands could be beneficial. And he also tells you that, yeah, you can do without bands, but you will lose more time or you will have more effort in order to achieve the good result. So I think that in order to be the full scale orthodontist, or in order to be the orthodontist who will not be afraid of anything in our profession, it makes sense to master the banding in orthodontics. It makes sense to know how to apply bands and how to apply the loops. And I think it makes sense to learn them on the course of Kleber Meireles, because it's very easy to advertise something that is really of high quality. And maybe someday when we'll see each other offline at some congresses and lectures, you will approach me and tell me, okay, Leo, thank you very much for this advice, because this is a very useful course that really made changes in my practice and made my practice more effective and better. And I'm sure about it. Even if you don't want to say it loud, I hope that you will at least think about it after you'll watch this course. You will get this information, you will learn this information, and you will be able to apply this knowledge in your clinical practice. And I wish you good luck to have great results and grateful patients. Thank you.